So there's kind of three levels I like to think of it of like different care and how therapy can work. On the one level, there's kind of more what I do, which is outpatient therapy, and that can be once a week about going to the office, be able to check in about different things that are going on, and a lot of like kind of work with the parents about different things that are happening. But sometimes if we feel like that's not enough, and we need to kind of upgrade the level of therapy, that's when we kind of look into things like an IOP, which stands for Intensive Outpatient Program. And this is something essentially that's sometimes a few different times a week. And there's some different programs in the North Shore community that are able to provide this kind of resource. And they tend to have a combination of therapy groups. Sometimes there's also an individual therapist that someone is working with. There could be a medication management and maybe some other sources of support. But the philosophy behind it is to really have multiple times a week that somebody in need is able to check in to be able to be provided with mental health support. So it's just like when the once a week is not cutting it, it's about having something a little bit more, a few different touch points during the week to be able to be able to address the issues that are going on. There's a further level up, which is called a PHP, a partial hospitalization program. And that would be something that's kind of like all day on those days. If it's found that there's lots of different support that is needed to address things that are happening. So a lot of it is just knowing that sometimes with therapy, it can be understood that, oh, that's just like a once a week thing. But the reality is that there's a few different levels to be able to meet somebody with where they're at in terms of like level of therapeutic support. And an IOP is a great way to just mobilize that and just be able to go to a spot to really be able to learn and kind of get real about what's going on. I think my whole thing with therapy is my sort of catchphrase for that is that in sort of the stage or performance of life is that that's where you go backstage and you can take the costume off and you can actually just talk about what's really happening. And an IOP is like a really just good way to be on a regular basis to be like, what's really happening here? Like instead of just trying to pretend like everything's okay, let's actually see what we can do and get real about this.